All right, great. Well, Dr. Reese mentioned that even in the Department of Defense, I thought you were going to get flooded with applications when you said you don't have to worry about the insurance companies, but you very candidly said you still have your own form of bureaucracy and red tape and barriers. Dr. Hoffman or Dr. Seco, what's your experience with barriers to getting patients in the VA the right treatments? Is it easy to get one of these gamma core devices and some of the more esoteric treatments that you want to get your patients, or is it pretty easy? Have you worked things out?
Yeah. So a couple of things on that, Dr. Shokin. So my experience has been that there's some upfront time that has to be spent sort of working with the team that eventually will help you order the device. So, for example, and as you know, sort of when I'm at the EHR and I want to order medication, I put it in, I sign it, and it's done. And I never have to worry about creating an order set to get everything all set. So when it comes to getting veterans neuromodulation, so I had to work with our local team in prosthetics, because in the VA, prosthetics is the group that oversees ordering and distribution of neuromodulatory devices. So I had to work with them to come up with a system by saying, these are the patients that we've identified, this is how we order it. We had to develop sort of an order set to make sure that the right information was collected, so that when they get their order, when prosthetics gets their order, they could fax it appropriately, so that there's no delays in getting the therapy to the veteran. So yeah. It took a little bit upfront, and but I'm a big believer in you get the right team members together, and everybody wants to sort of be on the same page and get something done, then it gets done. And we've shared the text for that order set with countless veterans, countless other VA medical centers. So this way, so places don't have to go and recreate the wheel.
Right. Okay, great. How about your experience, Dr. Hoffman? Any barriers still to tackle?
No, not anymore. I agree with Dr. Sicko. We did the same. We made good friends with prosthetics. we didn't Zoom them and we didn't phone them. We walked over to their department and we introduced ourselves and told them, listen, we really are very optimistic about this new device, and we're going to write the orders, and they're going to send it out. It is prosthetic, so it's different to pharmacy, of course. And it's worked exceptionally well. I've even had people in our prosthetics department overnighted to patients that insisted they needed it right away. And they're very happy to do it. And I think they're getting good feedback from the patients, because we reorder these devices all the time. And they tell prosthetics, yeah, this works. We're happy with it. And so prosthetics then plays a part in the treatment of the veteran, and it's generally good news, and I think it all works pretty well. But yes, you do have to make friends face-to-face with them first.
Well, that's good to hear. Some people who haven't worked in the VA system are probably wondering, what are you talking about? The government budgets by these areas, and anything that is a device is actually in the prosthetics budget. So, and now all the electronic devices like apps and things like that are in there too. So the prosthetics department has to figure out how they can handle all of this. And it sounds like they've been really good partners with you. But as Dr. Seco said, it's really worth taking the time up front to talk to them as colleagues and explain why you're doing this, which of course is on behalf of the veteran. And I'm glad that's working out for you.
So we sort of took that theme about working locally within the VA medical centers, and we've worked nationally with our friends in prosthetics. So now there's national sort of recommendations on how to order the neuromodulatory devices. And so the recommendations that we've come up with are now sort of nationally available to anyone in the Veterans Health Administration.